Are you or someone you love struggling with chronic pain? Do you think you're out of options when it comes to stopping that pain? Well, here to tell us how prolotherapy may be able to help is Dr. Timothy Special. He is a prolotherapist at Caring Medical Center. Good morning. Welcome back.
Yeah, enjoyed being
All
here.
right.
Thank you.
So this morning we're talking about sciatica, which is very common. People, you do hear, oh, I have sciatica.
Right.
I don't really know what it is, though. Maybe some people, other people don't even really know what it is. How do you explain what it is?
Well, people come into the office, Carly, and they're going to say, Doctor, I have sciatica. Okay, with sciatica, there is a nerve called the sciatic nerve. This is a picture of the pelvis.
Okay.
And if we look here, this notch here is a sciatic notch. And the sciatic nerve, which is a very large nerve, comes through there. But there's a lot of causes for sciatica. Sciatica is just a symptom. That's not a treatment.
And a symptom meaning just pain?
It would be
Does
pain
it
in the hip,
often
pain all the way down the leg. You might have numbness. You might have tingling a little bit. So that's just a symptom. The challenge is, now what do we do with sciatica?
Right.
Well, sometimes it will go away on its own, because people do have that. You ever sit down on a couch like we're sitting right now, and you kind of almost like you're on your funny bone?
Yep, yep.
Well, you sat and you say, oh, my leg, I can't quite walk. Well, you basically sat on your sciatic nerve is what you did.
Okay.
And it went to sleep. It'll come back. You kind of jiggle your leg a little bit.
Yeah.
But that's something that's going to go away in a couple minutes. But someone who's got a chronic sciatica or acute, like a really herniated ruptured disc or something, or the facets or degenerative disc disease can cause sciatica. One of the most common causes of sciatica, this is a picture, if they can show again, of the pelvis, Carly, and these here are ligaments, okay? This is the sacrum, okay? This is the ilium. These things that you see here, there are bands here, okay? They hold our body together, so they can refer pain down the leg, okay, into the hip. The people say it's my sciatic nerve. It's not. Most of the time it's from instability of these ligaments. Now, if we look at the model from here, the disc, people have heard of a disc. The disc can push backwards, but the reason it pushes backwards is because these ligaments get weak.
Well, just because they get loose,
they get
and then
loose
everything
like a
kind of
hinge,
moves around
like a hinge. They get loose. So the only way, so you can do physical therapy, which I was, Carly, initially, until I went back to medical school. And there's a good thing for that. But that's the muscles, and what happens is, because these ligaments are weak, the muscles take over, and then they're going to spasms. So people say they go to a massage therapist or a therapist, or they have trigger point injections. They're just treating the symptoms, as we talked about earlier. That's not necessary, okay? You have to get to the core problem. And
so talk about how prolotherapy how do you explain what prolotherapy is and how it may be able to help with sciatica?
Prolotherapy is a proliferant, okay? And they found out, Dr. Hackett years ago in the 1940s, if we inject things like dextrose or platelets or your own bone marrow or fat, we inject these in the various ligaments or tendons or cartilages, and it rebuilds it naturally. We basically jumpstart our immune system.
Giving a little boost.
Gives it a boost, like an echo boost, okay? What happens is, our body with chronic injury doesn't have a lot of good factors, growth factors. So what we do is we kind of trick the body into getting growth factors to this area. And then the body says, aha, I'm going to heal it. And so instead of being in a state of okayness, we want to be in a state of wellness. We want to function well. We get people back to work, back to sports faster, sooner, without the side effects.
Wow. Well, and how do you know if that you are a good candidate for prolotherapy? Because I know that you guys are very honest about, hey, this may not work for everybody, but
You know, it's funny, Carly. My wife Faith will laugh, because I'm in the airport. Everywhere I go, I look at people, and I tell them, she's pretty good at it now, too. I tell her that's her hip, their foot, their knee, their neck, or this, and she laughs about it, but we can tell very quickly. But Dr. Hauser is a physical medicine specialist. I'm an orthopedic physician. We're skilled in our hands and physical examination, so we're going to examine the patient, not just flip up an MRI or an X-ray, although we use those, and we coordinate it.
Well, and talk about, because we've talked about that before, and how you kind of look at the whole body and kind of what's going on, and sometimes people are just very concerned about what that MRI says.
Absolutely.
But it really doesn't show you kind of what you need.
Well, it's not a functional MRI, okay? There are some things as a functional X-ray of a neck, which it's a digital X-ray that we do use sometimes for instability, but most X-rays are static, okay? So I
if
look
we're talking
at
about
it,
joints or something, you need to see
you
how
need to
it's
be able to
moving.
examine. I could, like, if I showed you here, Carly, like if I grabbed your wrist right here, or your let's say I grab your wrist, I'm going to actually palpate your wrist. I'm going to move this around like this functionally, where the X-ray is just going to show the carpal bones.
Right.
See, there's a difference with that. So, I know we were going to talk about also So you talked about, I think you asked me earlier about fusion. So what would fusion mean, okay? You hear I'm going to have a fusion of my back. What do I do with that? The challenge is if you fuse a vertebrae here with hardware, you're going to wiggle more on top and wiggle down below. God didn't make us that way. We can, and they get loose, these hardwares. Now there's a place for it, but for the most part, 99.9% of people don't need that. Prolotherapy can rebuild their body naturally.
Well, I know, again, people are very interested to learn more, and again, this is just an option to consider before they maybe go to surgery, before they take more pain meds. What's the first thing that you suggest they do as we close here?
Well, you can either give us a call at our number that'll be on the screen
we've been
there,
showing it
or just call Caring Medical or look at our website. We have a great information. There's a lot of blogs and Facebook pages and very easy, understandable, a lot of information. Then they can look at it, give us a call, and we'll be glad to see them.
Well, I love how passionate your team is about people giving their quality of life back. And again, if you want any questions answered, you can call or head to their website, or you can go to our website, which of course is fox4morningblend.com.
We'll be right back with one last look at your Fox forecast.